All right, so we're here with Sam, and this is our fourth time doing a little videos and showing a little bit how your progression is. So Sam was at the doctor on Friday, and that was 6 weeks, a little over 6 weeks.
Yeah.
Were you with the doctors?
Mhm.
All right. So what did the doctor tell you?
Told me it was coming along well, but not to put more than 50% of my weight on it.
Okay, and the reason for that?
Just allows where it goes into the pelvis and all to get more tissue healing around it.
Yeah, and one of the things is, remember, we had that fracture that broke away.
Right.
So they had to put screws in there, and then they had to put a wire around it too as well. So we're going to show you the x-rays. The x-rays are coming across really well. The healing is just fantastic. He could put full weight on it, but we want to be extra careful in relationship to making sure that we don't injure him. So we've done a lot of things with him. We're going to come back and we're going to look at some things from last time, and we're going to continue to progress through. Sam's been great because we've had a lot of different protocols of our top 20 that we've been able to use. So what we're going to do is we're going to lay him back on his back here, and we're going to check some things. And what's the first thing that we're going to do? We're going to put glasses on today. Since we're a little bit more open, we're going to be doing some more things. So Sam's getting some glasses, I'm getting some glasses. And we're going to start with protocol number 1. So your belly button's here. I'm going to use this today where we're going to come right on skin, which is absolutely the best. I'm going to start by doing infrared, 2 inches below the belly button, right here. So the reason that we do this is that we want to reset the balance of the body. Many times in trauma, especially in injuries, you have what we call a withdrawal response, or a flexor reflex afferent, where you get centrally locked up, where muscles that should be working in unison, bicep, tricep, should be working one at a time, they get locked up together. So this point is really good for putting the body back in balance, balancing the acupuncture meridians, make sure that the body is very testable. Some people say it's like sort of peeling off a couple layers of the onion. So a lot of my friends of that's functional neurologists and that, they always want to make sure that the body is in good balance symmetrically, and so we check that through gait. So we start with infrared and then we go to red. So we're going to switch here into the different wavelengths. So we have the combination of infrared and red. We're putting this right on the skin, so we're in good position here. Again, about 45 seconds of each should reset the body. Where are we going to go after that? We're going to go spot number 2, which is going to be resetting the muscles or the nerve that go to the muscles. So after this, we're going to go to point number 2. So Sam, do you feel anything? If you feel anything, tell me if there's any warmth or anything like that. I just need to know. All right? Are you feeling anything?
No, it's fine.
Yeah, 99% of the time, the patient is going to feel anything, so we didn't need to know objectively by checking range of motion and muscle strength where we're going. All right, so now I'm going to switch to a different setting here, and we're going to go to the nerve setting. And we're going to start that in infrared, and I'm going to come here just to the right, and this is where we're getting some nerves from L1, L2, L3, and then all the way down to L5. If we recall from last time, we had a big weakness here in L5 on toe extensors. So we're going to reset the nerves, about 40-45 seconds of infrared and 45 seconds of red. One of the things we're going to do, Sam, I'm going to have you hold that for me if you don't mind, that we did last time, and we're going to continue to do, is we're going to look at the large diameter fibers, which are vibration, light touch. So I'm going to come into the areas of distribution while we're doing that and just do some light touch. So I'm just taking a Q-tip, you can take a cotton ball, you can take anything you wanted, and we're just going to stimulate the nerve. As you know, the nerve at the periphery goes in the central nervous system through the spinal cord, cerebellum, thalamus, neocortex, back down to brainstem, which is inhibitory towards pain. You have 3 primary inhibitory centers in the body. 1 along the dorsal horn of the spinal cord and 2 in the brainstem. So if I could only laser one place, where would I laser for pain? The brainstem. Now, I'm gonna come back with something a little sharp, which is the C fibers. And I'm gonna stimulate that a little prickly. Feel that, Sam?
Yes, sir.
The good part is he doesn't withdraw. Many times when you do this, the patient's gonna withdraw or get a little pullback, and that would be something that we know that's at a higher state, but we've done a great job in breaking that. So, let me switch here. You're doing good. Keep holding. I'm just gonna switch to red. I got the glasses on so I can't tell. There we go. So now I went from infrared to red, and I'm continue on. And I'm gonna laser this, laser, while we're doing the stimulation. Awesome, good job. Now, we can bend his knee pretty good, so I'm gonna do a little bit more thorough examination and checking some muscle strength after we do this. And then we're gonna get to some other cool stuff. All right, Sam, how you doing? Okay, all right. So keep holding that.
All right.
And what I want you to do is I want you to squeeze your knees together. Can you do that for us?
That's about it right there.
All right, don't let me pull apart. Ready?
Yep.
Hold. Pretty strong. Got a little bit of waver there, but not too bad. This is the same way I would look for treating his low back, and he has a history of low back pain, and we've treated him for that. So this is important because we can see that too as well. Now, bring the legs out. How's that? Is that comfortable for you?
Yes, sir.
Okay. We had trouble getting these muscles on the outside, the abductors should fire last time. Let's see how we're doing. I want you to push out into my hands. Push out. Now we got some strength going. That's exactly what we wanted. We wanted to push out. Now, I can't really internally rotate the legs very much because that's one of the things that can throw this hip out, and we just want to be very careful with that. So I'm not going to mess with that at all. But the other thing that we had decreased, I'm going to take these off, I hope you don't mind.
I'll bet.
Got it there. Is these toe extensions, L5, were really weak on the right hand side last time. Pull your toes towards your nose for me. Hold. And those are good. Remember I could pull them?
Yeah.
Move that table? Those are nice and strong. So what we did last time maintained, which is great. What we got was also some increased firing here, which we didn't have last time, which is also phenomenal. Okay? So we're going to take that away. I'm going to take that here. So we've done number one, we've balanced the body. We've reset the nerves, and we can see that because we have good strength here. We had good strength with the adductors, which are really important for pumping the lymphatics and getting all that fluid. That we really had a good, within like a couple of weeks, all that fluid and inflammation was out, which is the most important thing in any injury. You have to really get the inflammation out in order to get healing. We were able to use some things for the first 3 days for acute pain and then chronic pain. So tell us how your pain is right now.
Very much, man, really.
No, really. He gets a little bit when we stretch and do some other things, but it's more of a tightness, not an acute pain.
Right.
So you were probably on pain medications, what, about 2.5 weeks?
Something like that.
Yeah, so about 2.5 weeks, we were really able to control the pain, which was just really wonderful. All right, so one of the things that we're going to do in our top 20 protocols today is that we're going to come in, and this is a place that I go next, is that we're going to actually come in and we're going to work on the scar.
Okay.
All right, you ready for that?
Yeah.
So I'm going to have you pull this lift up for me, if you don't mind. There we go. And you've seen the scar. We're going to show you some pictures of it. Maybe we could come and zoom in on that scar right now. Okay, so we're zooming in on the scar so you can see that. We're going to give you some still pictures so you can see it as well. But really, it's healed up really nice. It really has. So I'm happy about that. He's going to be happy about that. And I just can't believe how wonderful that is. If you remember last time in the beginning, he had this big bandage and we were lasering over the bandage. So really looks good. So what we're going to do now is that I'm going to come back and I'm going to work on the scar. Underneath the scar, we have some scar tissue, and so we want to break up that scar tissue, which increases the frequency of firing of those nerves and that tissue in there, which is also inhibitory towards pain because we're going to start pushing him now. Now comes the fun part, but we've really got you in a good spot where you're stabilized, so when I get you up and walking and doing those other things that you're doing, we're in a half walk right now where you can allow 50% on the leg, then we're not gonna have any problems. We wanna make sure it's stabilized in the other. So, for breaking up scars, I use a couple different things. You can use ozonated olive oil, you can use MSM lotion, which is great, and then I like using enzyme ice. So what I'm gonna do is I'm gonna come in and I'm gonna put some enzyme ice on the scar, and we're gonna laser that in. So we're gonna put the enzyme ice in, we're gonna laser the enzymes into the scar and the scar tissue, and we want to break that up. So that's our goal here for this session, is really start working on the scar and breaking it up. How's that feel? A little cold?
Oh, that's cool.
Yeah, it's a little cool. And so I'm in the scar now. So I'm going, and I don't know if you can see my finger, but every time we see a little dip, that scar is just not quite where I want. So we don't have much collagen here as we'd like to be. So there's one, there's 2 spots. Three spots. You can feel where this collagen quite hasn't come up like we would like it to be. But for a scar like this, we're really looking at 5 or 6 spots that really haven't got where we want. But look how straight it is. It's awesome for a scar that big. I mean, gosh darn. We sure made that doctor look good, didn't we?
Yeah.
So that's wonderful. Okay, so now that I've put this on, we're gonna take it and we're gonna laser. So we're gonna laser in, we're gonna activate those enzymes. And then I'm gonna come in here and manually, I'm gonna break that up.